दिल चाहता है दिल चाहता है. Let's learn what heart actually wants. It wants oxygenated blood from the ascending aorta. Heart is supplied by left and right coronary artery. For right coronary artery, it arises from the anterior aortic sinus of the ascending aorta, which moves between the right auricle and pulmonary trunk and moves along the right atrioventricular groove, and at the inferior of the heart, it winds up and form anastomosis with the circumflex branch of the left coronary artery at posteriorly. For left coronary artery, it arises from the posterior aortic sinus of the aorta. Then it moves between the pulmonary trunk and the left auricle, and it divides into circumflex branch and the anterior interventricular branch. The circumflex branch make anastomose with the right coronary artery, whereas the anterior interventricular branch moves and reaches the apex of the heart and winds and anastomose with the posterior interventricular branch of the right coronary artery posteriorly. Branches of the right coronary artery, they are nodal branch, right conus artery, marginal branch, it is the largest branch of the right coronary artery, and the posterior interventricular branch. For left coronary artery, two main branches are circumflex branch and the anterior interventricular branch. Talking about the area of supply by the right coronary artery, it supplies right atrium, right ventricle, except the area adjoining anterior interventricular groove, and posterior 1/3 of the interventricular septum, and nodal branch supply 60% to the SA node and also supply to AB node. We have supply by the coronary artery. It supply most of the left atrium, most of the left ventricle, except area adjoining the posterior interventricular groove and anterior 2/3 of the interventricular septum.